My name is Mike Kalkhoff. I'm a family physician here at Lakes Regional Healthcare. I grew up here in Spirit Lake and then was fortunate enough to return to the area a few years ago. So after growing up in Spirit Lake, I went to Iowa State for chemical engineering, then I studied medicine at University of Iowa before going to Wichita for my residency. My wife and 3 kids, and I enjoy living in the Lakes area and enjoy all the fun activities that the Lakes area has to offer. My father's also a family physician, and so a lot of medicine has been talked about at our house over the years, and I think that's initially what piqued my interest. I always liked math and science in school and eventually studied chemical engineering at Iowa State before deciding that I really wanted to do medicine and applying to medical school. I really like doing preventative care along with seeing people in their greatest time of need. And so a combination of both seeing people for wellness visits to control their hypertension and their diabetes and those kind of things, talk about weight management or stopping smoking, doing all of those things, but then also seeing people kind of when they're in crisis and coming to the ER and into the hospital to take care of them for their heart arrhythmia or for other things as well. I was really drawn to the specialty of family medicine, getting to do preventative care along with taking care of moms and babies with pregnancy and really providing full spectrum care. And you really get to do that well in a rural setting. Fortunately for me, there's a good health system, Lakes Regional and Avera here in my hometown, so I was able to both come home and practice the type of medicine I wanted to practice. We can't discount the importance of physical activity, moving our bodies. I mean, nutrition is very important in terms of our obesity epidemic, and nutrition is probably more important for obesity than it is the physical activity is. But moving your body is so good for your heart, for your lungs, just for your general well-being, that I think physical activity and trying to get at least that 30 minutes, 5 days a week kind of as a minimum is really important. It's really fun as a family medicine doctor getting to develop that relationship with patients. Oftentimes we have to cut to the chase after 5 minutes of talking about family or friends or activities in the area, and then getting down to business of talking about their diabetes or their hypertension or that kind of thing. And so it's really nice just getting to know people over time and developing that relationship. And sometimes you see the whole family, you see the grandchild, the grandparents, you see everybody in between, and it's just really nice to be able to know the whole families and be able to ask how the different family members are doing and that kind of thing as well. Healthcare, there's a great need. There's a great need for primary care and for family physicians, and so each day you don't know what challenge is going to be brought before you, but there's lots of people who need care and need help with different health challenges. And so just every day not knowing what you're going to be expecting to handle that day, but knowing that there is going to be probably a new challenge and getting to help meet people where they are and help them through that. Really enjoy all the activities that Iowa Great Lakes have to offer, between the boating and water skiing type activities to riding a road bike around the lake as much as we can, and love spending time with my kids at the beaches and going to Arnold's Park, and really just enjoy all those different activities the area has to offer. I grew up here, and so it's been really fun coming home and seeing my kids, enjoy the things that I enjoyed as a kid growing up, and then being able to practice and take care of my community, taking care of my old teachers from school, and being able to, relate to my community in kind of a new way and kind of give back to the community that I kind of grew up in.